Hey guys, it's Justine Buick from the NCLEX I'm a registered nurse and my background is in med-surg, nursing, and education. And so today I'm kind of excited about this video because this is going to be about the changes to the 2026 NCLEX test plan. So that is the document that we use as educators to help students pass the NCLEX exam so that they can become a registered nurse. And I'm going to go through and show you what the changes are, but the main reason why I'm doing this video is because I've had a couple students recently and they said to me, oh, I really want to take the test before April 1st of 2026 because I heard that the test is going to get harder, that there's going to be a new way of thinking, that the questions are going to be different. I just want you to know that the bottom line is that the NCLEX is not changing, okay? There's very few changes. And I'm going to show you that in this video. So let's get started. Okay, here we are at my website, the NCLEXtutor.com. You can just click on blog. And you can click on the blog post, changes to the 2026 NCLEX test plan. And I'm just going to go through this blog post that I did because I did screenshots of all the different sections of the test plan, okay? And I compared it to the 2023 test plan to the 2026 test plan. So as we scroll down here, the overview of the changes, okay, this is really important. The passing standard is the same. The categories are the same. The types of questions are the same. This thing called the integrated processes, those are the same. The clinical judgment model and the case study questions, it's the same. And there's just some minor changes to some of the statements, and I'm going to show you what those are. Okay. So the passing standard just basically means that the test questions from 2023 to 2026, they did not get any easier, they did not get any harder. They are exactly the same. And on December 19th, I got the email from the NCLEX people, NCSBN, and they say it right here. The passing standard will remain at the current level of 0.00 logits, and that's for the RN, and then the PN exam is negative 0.18 logits. You don't need to know what the logits thing is. It's just something that their psychometricians, their mathematicians at the NCLEX place, it's how they measure how hard or easy something is. So they just give it a number. But anyway, the bottom line is the passing standard is the same. So we don't have to think like, oh no, the questions got harder. No, they did not. Now the categories being tested on is exactly the same. So what I have here is, this is 2023 and it has the different sections of the test plan, and it tells you, the percentages for each section of that test plan. And this is the 2026 NCLEX test plan with the percentages. And can you see that this pie chart at the top here is the same exact pie chart on the bottom, okay? What I noticed, what was different about the 2023 versus the 2026 is the columns are more narrow, okay? I mean, I wouldn't really call that a change. You can see that the columns are wider in this one. It's the same categories, all right? The types of questions are the same. So in the screenshot above, in 2023, it said there's going to be 18 case study items with 3 item sets. So basically that just translates into 3 of those 6 question case studies. It even says the same thing. Here's 2023 right here, 2023, 18 case study items and 10% of the standalone items. So those are the case studies where it looks like a more complicated case study, but it ends up just being like one question. An example would be a bow tie question. And you can see here in 2026, it says the same exact thing. They just copy and pasted it, okay? 18 case study items, 3 item sets, and 10% standalone items. And then the rest of the questions are going to just be those traditional questions, like whether there's just one answer or select all that apply, maybe a hotspot. The integrated processes are the same. Like, what does that mean exactly? So they say that there's 6 fundamental processes that are going to be included throughout the NCLEX exam. So any one of your questions could apply to something that you're being caring, or you're using clinical judgment, or communication and documentation, culture and spirituality, the nursing process, and teaching and learning. And when we look at this is for 2026. You can see that at the top. These are the integrated processes. That has not changed. That's still the same. And then also clinical judgment is the same. So this is a screenshot from the 2026 test plan. And this is the same. The clinical judgment is basically the steps that you go through in order to answer one of those 6-question case study questions. Or sometimes you'll use the clinical judgment model to do one of those standalone case study questions. So that was something new that they did in 2023 when the case studies came out. I mean, that was a big change back then, 3 years ago. It's the same now. 2023, you still have the case studies with the clinical judgment as 2026. So no changes there, which is really good. And then the nursing content being tested on, okay, your nursing content is the same, okay, within the client needs categories. So they go through, there's 8 different sections, and they go through them and they say, these are all the different things that you could get asked about. So I went through them and I compared them from the 2023 plan to the 2026. And, you know, people out there are probably going to scare you and be like, oh my God, it's totally changing. No, it's not. It's like basically the same. So management of care is about 18% of the test. And what I did here is I screenshotted the 2026. So no big changes. They actually added a new word. So instead of saying collaborate with the multidisciplinary team members, they said identify and collaborate with the multidisciplinary team members. I mean, that's not that huge of a change, okay? I mean, you're still working with the multidisciplinary team members. They actually added a new statement, and this one is a new statement, but it's nothing new. You already know this, that you have to perform care for clients to support unbiased treatment and equal access to care, regardless of their background. So that kind of was already covered, and there's a psychosocial part of the test that talks about the cultural and religious sections. We already know that. We have to be non-judgmental. We have to provide care. We have to try to be as unbiased as we possibly can, okay? But we already knew that. That's not a huge change, okay? We already knew that. So those were the only changes in management of care. Safety and infection control. The new changes in this, I mean, are not anything really. They added the word environmental. So they say follow the security plan and procedures. And then they just added environmental. So apparently we have to follow the security plan for the environmental issues. Which, like, what does that mean exactly? I see it as if there's a disaster, like a chemical warfare or biological warfare disaster, if there's an active shooter, if there's a chemical spill, but we already knew that. They sort of were just getting a little bit more detailed in their list here. It used to say educate the client on safety issues. Now it just says safety concerns. To me, that's the same thing. This says report, intervene, and or escalate unsafe practice of staff. And then they have examples, substance misuse. Well, it used to say substance abuse, but now they changed it to substance misuse. You know, for our purposes, it means the same thing. And then they added promote staff and workplace safety. It used to just say promote staff safety, but now they added the word workplace safety. That to me is nothing new in regards to nursing content. We already knew that we wanted to promote workplace safety, such as preventing fires and preventing patients from getting too violent. Health promotion and maintenance. Let me see. There were absolutely no changes. They didn't change any of the wording. They didn't add any words, take out any words. There's no new statements. What I think is funny though, they did change the order of the statements, which that's not really a change. I actually showed you here, 2023, you can see it here. The column actually is more narrow. And then in the 2026 one, they widened out the column. Okay, no big deal. Psychosocial integrity, 9% of the test. So they just made one change. Instead of saying substance abuse, they changed it to substance misuse. Same thing. And then basic care and comfort, they actually added a new statement. I like the new statements that they added. It wasn't anything that I didn't already know. Like, I already knew this stuff, and you already know this stuff when you go to nursing school, but they added maintain client dignity and privacy during care. So we already knew that we needed to do privacy, like the HIPAA and confidentiality and all that. But they added this client dignity thing, and we already knew to be respectful to patients, but I think what they're referring to is when, say, you're giving someone a shot and you have to give it to them like in their butt. Well, you're not just going to be like throwing off the sheets and exposing their butt and giving them the shot right in front of everybody. You're going to make sure that the curtain is closed. You're going to make sure that you only show the area that you need to give the shot. So that's what they mean. But didn't you already know that? Yeah, that's what I thought. All right, so pharmacological and parenteral therapies, about 16% of the test. That's a big section of the test plan. Absolutely no new changes, except for they made the column wider, okay? They probably put it in a different order too. In fact, I know they did because I looked through this and I thought, oh, it's in a different order. Reduction of risk potential, that's 12% of the test. Let's see here, they did a couple changes, nothing too extreme. So they added, so first of all, this was always a statement, perform testing within the scope of practice. Okay, so you're going to perform testing within your scope of practice and like electrocardiogram. They took out the word glucose monitoring, even though you know you need to do glucose monitoring. I don't care if it's the 2023 or the 2026, like you have to do that. But they called it, instead of glucose monitoring, they called it point of care testing. Point of care testing are just tests that you do at the bedside. So it could even be like a dipstick to check for protein in the urine. So they kind of just made it like more broad. They also added fetal monitoring to that statement. So you have to perform that fetal monitoring. So that would be when you have to do that intrauterine device monitoring where you're checking the contractions along with the baby's heart rate. But didn't you already know that? Yes, you already knew to do that. This one right here, they changed the word. It used to say anti-embolic stockings, and now it says anti-embolism stockings. Okay, that's the same thing. That's the same thing. All right, physiological adaptation. I think this is the last section. So this one right here, they added a new statement. Okay, it said monitor and maintain internal monitoring devices. Example, intracranial pressure monitor and intrauterine pressure catheter. The intrauterine pressure catheter, that's what we use for when we're monitoring the fetal monitoring. So like the baby's heart rate along with the woman's contraction and like what's that heart rate doing. Do you remember veal chop? That's where veal chop comes into play. We kind of already knew about intracranial pressure monitoring and making sure that we're, monitoring that and on the lookout for that and how to take care of patients who have increased ICP. And the reason we already knew to do that is because if we go back into the 2023 test plan and we go in here, it says provide care for a client experiencing increased intracranial pressure. Well, if we have to provide care for someone who's having increased ICP, we probably already know that we should probably monitor increased ICP with the ICP monitor. Like we already kind of knew that, but they just got a little bit detailed, and I kind of like that. I like more detail in the NCLEX test plan because then I'm like, okay, I know exactly what they could be asking my students about. All right, so what does this mean for nursing students overall? I want you to not be scared into thinking that the NCLEX test has changed, that it's not going to change April 1st, 2026. It's basically the same test. If some students who are saying in January here and they were going, well, I just want to take it before April 1st, before it changes, because I've heard stuff. That's not why you want to take it before April 1st. You really want to take the test within a few months of your graduation. You don't want to really wait a whole long time because then you're going to start forgetting content. All right, you can still use your favorite content review course to review your content. You can still use your favorite QBank to do your NCLEX style questions. And I want you to also know that I think it's really hard to go through this NCLEX test plan on your own and kind of go through and figure out, okay, I better review that, I better review that as a checklist. I think it's really hard to do that because you don't know exactly what you need to know for each of those sections. But my students do. I definitely do. And I did the Nugget Pages book. So that's the book that I use with my students. It's right down here. So that's what I use with my students to review content, and most of them use it. Not everybody, but a lot of people do. And it looks like this, and you can go on my website and you can go check it out. And I even have an NCLEX test plan index that goes through and it tells you each of the different sections and what page to go to in the book if you wanted to review that content. But I'm gonna say you don't need to use my content review stuff. Many of the bigger NCLEX prep companies cover the same topics, okay? So it's just in a different style. I think that if you're not sure what to use, you can always get a free account and try them out, see what you like, see what style works for you. Well, thank you so much for watching. I hope you found this video helpful. You can hit subscribe, hit like. If you have any questions, you can put it down in the comments. If you are interested in private tutoring or getting my Nugget Pages book, you can go to my website, thenclextutor.com. Thanks, bye.